Then there's California, a podcast featuring members of the California State Senate Democratic Caucus discussing their lives, legislative priorities, policy, and other issues that help make California exceptional. From the state capitol in Sacramento, I'm Brian Green. June is Pride Month, when California's, America's, the world's LGBTQ community and allies come together to celebrate the fight for and acceptance of sexual and gender diversity. Pride Month is traditionally celebrated with parades and parties and festivals and rallies and screenings and food and hugs and cheers. But for the first time in its 51-year history, Pride 2020, here and abroad, has been postponed or canceled due to the ongoing coronavirus crisis and the importance of following social distancing recommendations. But you can't quarantine Pride, and plans are being made all over the galaxy for a virtual Pride, featuring online versions of those same street-side celebrations and visibility and advocacy, and likely continued reflection on how Pride 2020 is bringing into sharp relief the deep needs among the most vulnerable in the LGBTQ community, which threaten to become more extreme as the pandemic continues to cyclone its way across the world. The LGBTQ community was already impacted by high rates of unemployment, food insecurity, health disparities, mental health and suicide crises among LGBTQ youth, discrimination in the medical world, and it may be years before anyone is able to tally up the damage that COVID-19 is inflicting on compromised populations of LGBTQ persons and communities of color. On this edition of Then There's California, we'll talk about the significance of Pride Month in the lives of our global LGBTQ community and in the individual lives of those participating. The unique significance of Pride 2020 as a lens into the COVID-influenced challenges the community faces. The efforts to make the world aware, through stats and records, of how this pandemic has impacted the LGBTQ community and how the COVID-19 experience is impacting the future discussion of other challenges facing California in this unusual year of 2020. State Senator Scott Wiener is the chair of the California Legislature's LGBTQ caucus, and he represents the 11th Senate District in San Francisco. Senator Wiener, along with some but not all of his legislative colleagues, is back in Sacramento at the Capitol after a couple of months of sheltering in place and being in touch 24/7 with his San Francisco district. And we are, as we speak, sitting in an empty committee hearing room here in the state capitol so we can socially distance as we talk in person. We last talked to Senator Wiener during Pride Month 2019, a year ago, and what an eternity has passed since then. Senator Wiener, welcome back to Then There's California.
Thank you for having me.
Good to see you in person.
Absolutely. It's interesting to spend a few months in my home in San Francisco.
Yes.
I learned a lot about it, and I'm happy now to be back in the Capitol.
Well, how does it feel to be back in Sacramento? How are you doing with it?
It feels good. I mean, I was very, very eager to get back. We have so much work to do around the budget, meeting our health and economic challenges, and then around the many other issues like housing and mental health. And so I'm really thrilled to be back. The Capitol is a little bit like a ghost town.
Yes.
As it should be. We want to be socially distanced, but I really want to pay compliments to the Senate staff for having done an amazing job setting everything up so that we can conduct safe and healthy socially distanced hearings. So I feel good about where we are.
Well, we're glad to have everybody back, and we know the business of California still continues. Going back to your own personal experience, you have shared that you are not reflexively a homebody. You are a guy that leaves in the morning and comes back late at night, and you're there with your constituents. But we know that there's no rest for you while the work is to be done, and you've still had time to be present in your community. So talk about what you have done and that struggle with changing your life around, your logistics, your transportation, but also focusing on the needs of the district.
Yes, elected officials, if you're any good at what you do, you are wired genetically to want to be around other people as much as possible. And for me, I really derive energy from being with my constituents and being in the community. So it was a real difference to have to spend so much time at home. But I did a couple things. I did an enormous amount digitally. And it was interesting to me that, normally when I hold like a community town hall at an elementary school or a community center, maybe 100, 200, maybe if I'm really lucky, 300 people will show up. But when I would do digital town halls, I've done almost 20 on Facebook or Twitter or Instagram or wherever, there were times when 2,000 or 3,000 people would view at least a portion of that town hall. So you are end up in some ways reaching many more people. And so even when we go back to normal with human interactions and being in these live events, I'm going to continue to do more digitally because you reach people who are never going to actually go to a live event or a live town hall. I also, early on, when the shelter-in-place started, I decided to really focus on food insecurity. California has a big food insecurity problem, and COVID has made it worse.
Absolutely.
The lines at food banks, the people who are struggling is extraordinary. So I started volunteering at food banks and other food service organizations to help, but also because I wanted to see with my own eyes on a regular basis the pain of my constituents, not just read about it or read emails or talk to people on the phone. I wanted to see the people standing in massive lines waiting for food as a constant reminder to me that this is harming so many people and we have to take bold action.
And your staff did what other staffs of every other member of the legislature did while the Capitol was closed and in recess. Everybody went into overdrive with assistance to the community. So you were out there as the elected official, as the legislator, but you had the staff behind you.
My district staff, and kudos also to my Capitol staff, were pitching in on constituent work. So it was really a team effort. But my district staff, obviously from home, have been working so hard, including on the weekends, to respond to constituent needs, particularly around the challenges around getting unemployment, renters who were scared that they were going to get evicted because they couldn't pay rent, people who needed food assistance, all sorts of challenges. And my district staff have really heroically been there to help people in their time of need, and I'm just so grateful for their service.
As we all know, San Francisco was the first municipality in America, not just California, but in the United States, to shut down in the middle of March when this pandemic became what it was, a pandemic, to roll up the sidewalks and batten down the hatches and declare its own quarantine. And that was shocking to the rest of the state and the nation. San Francisco is closed. People couldn't believe it. But in hindsight, it was the wisest and most blessed thing to do. It saved so many lives. And of the thousands and thousands of Californians that we hear about every day that have been affected by this virus or have lost their lives, only a small sampling, relatively, were from San Francisco.
Yeah, obviously I'm a San Francisco fan, but I am really in awe of my city, even more so than usual. And San Francisco did work collaboratively with 5 other counties. They tried to move in lockstep, so it was a good regional effort too. But we are very lucky in San Francisco that, nationally and statewide, we've seen a real reduction of public health infrastructure in recent decades, and we're paying the price now that we don't have public health infrastructure like they have in Asia or even in Africa, where you have African countries that have dealt with Ebola who were able to spring up to do contact tracing and testing, but we were caught with our pants down in this country. San Francisco, unfortunately, but fortunately, because of we were an epicenter of the worst of the HIV/AIDS pandemic in the 1980s and 90s, San Francisco really built up its public health infrastructure. We have a large and very effective Department of Public Health. We have a strong consortium of community-based clinics, health clinics. We have an amazing array of hospitals, brilliant medical and scientific talent at UCSF and at San Francisco General and so forth. And so we have a brilliant director of public health, Grant Colfax, who came up during the worst of the HIV/AIDS pandemic. And we have a strong pro-public health political leadership, including our mayor, London Breed, who gets it. But most important, we have a population in San Francisco that is very savvy about public health, that understands that when your Department of Public Health tells you you need to stay home, that you got to do that it means something. And so when you look at the polling in San Francisco and the Bay Area on the shelter in place, they did a poll a couple weeks ago, over 80% support.
Yes.
It's not controversial in San Francisco. So I'm very proud of my city and my mayor and our public health leaders for acting boldly, and it's extraordinary. And it's not typical of some other cities. I was on the phone last night with one of my constituents, a community leader, African-American, gay man, who is from New Orleans, and we were talking, and he was telling me that he has lost 4 family members in New Orleans who have passed.
Wow.
Plus his brother was on a ventilator for a month. So there are cities and communities, and we know the disproportionate, horrific impacts on the African American community. You compare that to San Francisco. We are fortunate, but it also has to do with good government.
Let's talk about Pride. 2019 marked the 50th anniversary observance of Pride, prompted by the 1969 Stonewall riots in New York, and it morphed 50 years later into this extraordinary month of celebration of love and dignity and joy. When was your first Pride, and what did it mean to you as a young man?
So my first Pride, I want to make sure I get the year right. I think it was in 1994. I began to come out in 1990 when I was 20. And then in 1994, I was 24 years old, and I was living for the summer in Philadelphia. And my parents, who are amazing, and they had gotten involved in PFLAG. And so in Pride of 1994, I marched with my parents in the Philadelphia Pride Parade with PFLAG. So that was my first Pride. And then the next year, in 1995, I was in law school, and I spent the summer in San Francisco working at a law firm there. And I marched in the San Francisco Pride Parade with a contingent of LGBT people from my law firm. So that was my first San Francisco Pride. And I don't think I've missed a Pride since then. And it's definitely, Pride has changed over time. It has become, more commercialized in a lot of ways and just bigger. The Pride Parade in San Francisco has gotten so big that if you're like further back in the parade, it's like your whole day is blown because you have to weigh in. And you have some companies like Google or Facebook that will show up with like 6,000 employees. And it's great in a lot of ways because you have a lot of people who are not LGBT who want to be part of it. And so that's terrific. But it is easy to dilute the message of what Pride is about. Pride started as a protest. It was a protest 50 years ago in New York and San Francisco, stemming from the Stonewall riots in Compton's cafeteria and the Black Cat in LA a few years before that, a protest against true oppression of our community. And obviously it's more of a celebration now, but we have to always remember that with all the strides we've made, it's not a celebration for all members of our community. We continue around the world to see LGBTQ people murdered by their governments. We continue to see in this country with our current administration issuing all sorts of executive orders trying to deny us health care, and trying to allow religion as an excuse to discriminate, trying to erase us from health care questionnaires. And we see even California, where almost half of homeless youth are LGBTQ, where we have so many LGBTQ seniors who are in long-term care facilities and are isolated and have no support and are getting discriminated against, where we have continuing high unemployment rates among trans people and continued criminalization of our community, even in California, which we're trying to change. So we still have a lot of struggles. We still have a lot to protest, but we do have a lot to celebrate. We've made a lot of progress.
And I know this year, as with so many other large gatherings and large celebrations, it's going online in the spring of pandemic, the Pride 2020. As somebody put it, the writing was on the rainbow. And so the in-person celebrations and the commemorations have been canceled or moved online, which I know is a heartbreak to the community. What is going on in San Francisco in terms of that transition from the parades to online?
I think there are a number of Pride-related digital events that are being organized by different segments of the community. I'm going to have my own Pride-related digital event. And so I think it'll be, my view is none of us asked for this virus, but it's here. The situation is what it is. We can get depressed about the fact that we're not going to be together, or we can make the most of it. And my view is we make the most of it. This will be a unique Pride, because by next year, God willing, we will be able to move back to in-person Pride, knock on wood. And then we can look back, and this will be a moment in time, a difficult time period where we had a different kind of Pride, and we just need to make the most of it.
And it is possible that the online celebration will give some of those in other parts of the world that perhaps live in repressive countries where they can't go out and share their identity publicly, they can participate there.
Absolutely, and I think that should be a priority to do that kind of outreach, to be inclusive and come together digitally as a global community.
I want to go back to something you said earlier when you were talking about your first Pride. You said you marched with your parents. You came from New Jersey, a conservative town, but you marched with your parents. Did you have that freedom in your life at that time to declare your identity?
My town was conservative. My parents are not conservative.
Okay, there's a distinction, yes.
Yeah, no, my parents are very, very liberal, progressive people.
Amen to that.
Yeah, and so I'm very lucky that, I did grow up in a conservative area, but my family, they're liberal, but I also have, we have other LGBT people in the family. My mother's oldest sister came out as a lesbian in the 60s. My father's niece, my cousin, who's older than I am, she came out as a lesbian in the 70s. And then my mother had a cousin who tragically passed away, but who transitioned and was transgender before she passed. So we always had, particularly lesbians around and their partners. And so growing up, members of our community were around us. And so when I started to come out in 1990, first of all, I had lesbians that I could turn to. And then when I told my parents, it's always hard to tell your parents, but of course they were immediately fully supportive and never even blinked. And they're really amazing human beings, total salt of the earth. They're the kind of people who, they don't understand why anyone would ever be mean to anyone else. They're just the nicest people and, very supportive.
Coming from such a supportive family with your sexual orientation and your identity, did it surprise you to some degree to see other friends, perhaps, or more people that you had met as you came of age that didn't have that?
No, it wasn't, because we grew up in a town that was, I wouldn't say it was like right-wing. It was, a town that was probably majority Democrat, but voted for Ronald Reagan, that kind of town. But it was conservative. It was a sort of Italian, Catholic, traditional kind of town. We were one of the few Jewish families in town, and I had experienced anti-Semitism growing up. So I was aware of some of those prejudices, and I knew, for me, because I actually admitted to myself when I was a sophomore in high school or a junior that I was gay, but I also thought I could never tell anyone because I might get killed. So I was aware of some of the challenges, and I knew that I was lucky to have a family that was very supportive.
I appreciate you sharing that. Let's pivot back to what you were talking about earlier, Pride Month being the time to acknowledge and put into context some of the suffering and disparity facing LGBTQ Americans, young and old, especially those of color. The COVID-19 virus is pummeling this community, leaving this population vulnerable to health care and employment discrimination, as you had said, and now these, what they call, this is just the oddest term, the comorbidities of smoking and HIV and AIDS. Let's talk about that further, what this is doing to the community, particularly in your hometown of San Francisco.
Well, what COVID has reminded us in many ways is the critical importance of collecting data relating to health care and health impacts. It's a very dry topic. Most people don't focus on it. But when you look at what we're learning about COVID, when we learn that African American people have dramatically higher death rates from COVID than other communities, that Latinx communities have dramatically higher infection rates compared to other communities, when we learn that older people are more vulnerable than younger people, or that people with certain health conditions are more vulnerable than other people. We only know that because we collect data. Because when people come in to get tested or treated, they're asked, what is your race? What is your gender? What is your age? What are your pre-existing conditions? And then we get data on that. And we can learn from that. And we know that particularly with the Latino community, higher rates of diabetes, more likelihood to be in a frontline essential worker role, less likely to be able to work from home. In lower income communities, more crowded living conditions where you can't shelter from other people. In the African American community, also frontline workers, higher rates of asthma and heart problems, et cetera. So we learn this, and then we, with that data, we're able to take action. We're armed with the information we need. For the LGBTQ community, we know that we have health risks. LGBT people have higher rates of HIV, higher rates of cancer, higher rates of smoking, higher rates of homelessness, which are all higher risk factors for COVID or for serious impacts from COVID. And yet, we continue to collect essentially no data on our community. People are not asked. They're asked, okay, what's your race, what's your age, what's your gender, but nothing about what's your sexual orientation, what's your gender identity.
Right.
And we've been asking for that for a long time. It hasn't happened. There's been some legislation passed, although it has holes and gaps in it. So lo and behold, this pandemic breaks out. We immediately note there are problems for our community, but no one's collecting data. And we've been yelling and asking, and it's not happening, not just in California, but elsewhere. This is not just a California issue. It's a national problem.
And it's being ignored nationally, all but.
It is. The governor of Pennsylvania issued an executive order, and that's the only one we're aware of. We have been working with the Newsom administration. We've asked the governor to issue an executive order. I think he prefers legislation, and we'll work with him on the legislation. We're happy to have his support. So we did introduce legislation. I introduced it on behalf of the LGBTQ caucus. The pro tem is a co-author. All of our caucus members are co-authors. And it will mandate data collection on COVID. The California Department of Public Health tells us that they're in process of updating their database. We want to make sure the counties do the same because there are various databases. We need to make sure that the healthcare providers are actually asking the question. So it's complicated, but we're moving that bill forward. But we also need to make sure that this never happens again. So whether it's this year or next year, we will pass comprehensive data legislation to say that for all of the 90-plus reportable communicable diseases, including COVID, that this data must be collected. We can't let this ever happen again. There's been some press insinuation that we're criticizing the governor, or that our advocates are blasting the governor. This isn't just about the governor. This is collective, right? This is about governors before Gavin Newsom. It's about the Department of Public Health. It's about the counties. It's about my own county of San Francisco. You can't just put this on Gavin Newsom. This is, we have a pandemic and he's doing the best he can. This is a collective responsibility for all of us at all levels of government to collect this data.
And one could ask, why hasn't this been collected? What are we afraid of? Are we afraid of getting this data and maybe having to admit to ourselves that we're leaving a population behind?
Well, I think there are a few things. The LGBTQ community has typically been an afterthought on a lot of issues because we're smaller. People just they don't think of it, and it's just not considered a priority, and that's a bad dynamic that's been around for a long time that we're trying to change. But the other piece of it is there is a perception that sexual orientation, gender identity is somehow a dirty little secret. That's a private, secret thing that we don't want to talk about. We're violating people's privacy if we even ask about it. And that's a very old concept that we somehow should just be, it's fine if you're LGBTQ, but it's no one else's business, and you should just keep it to yourself and don't talk about it. And that's frankly homophobic, transphobic. Of course, as with all demographic data, no one's required to answer questions. When you're asked on a healthcare questionnaire, what's your race? There are people who don't want to answer that because they just don't want to, and they don't have to, but most people do. Same with sexual orientation and gender identity. If someone doesn't want to answer it, that's fine. It's voluntary, but most people will answer it. And so we need to move past this notion that being LGBTQ is somehow secret, private, something to shy away from. That's not the case. It needs to be front and center, and we need to collect that data.
The coronavirus is a perfect storm for the LGBTQ homeless youth in our country. I had mentioned to you before we started, I had reviewed over the weekend this white paper that was published by the Trevor Project, this national nonprofit that focuses on LGBTQ youth in crisis. And it starkly outlines these implications that the pandemic could have on the physical and mental health of the youth, the shutdowns of the schools and the youth programs that are happening across the country, the budget cuts at the community centers, which are this nexus between health care and social support. Where do they go? What's happening with these young people?
Yeah, I think this pandemic, it's hard for a lot of people for a lot of reasons, but I think for young people in general, for kids, this is really, really hard. Just for kids in general who now, they're not going to school, they're not with their friends, they're not getting, and homeschooling and remote learning, it works well with some families, but for a lot of families it doesn't, right? If you have 10 people living in your house and there are 3 different kids who are or 5 kids supposed to be doing remote learning, and there's always other people around, how on earth are those kids supposed to focus and do their remote learning? And so for a lot of kids, I think this is really hard, especially kids who lack enough familial support. And for LGBTQ kids, whether they're middle school, high school, college, it's exceptionally hard, particularly for these kids who don't have support or maybe even have hostile parents at home who no longer have that outlet where they can at least could go to school every day and be around other kids who are like them or who support them, have a teacher or a guidance counselor who they can talk to. And now they don't really have that as much anymore. And absolutely, for our most at-risk LGBTQ youth, not having community centers and other outlets, places they can go to be with their community, it can be very, very harmful. And they have to just connect digitally. And for a lot of these kids, they can do that. It's not as good, but they can at least, whether it's FaceTiming with people or doing, some sort of group digital thing or social media, having that access is a lifeline. But it creates a lot of challenges. And for the homeless youth, I'm very close with Larkin Street Youth Services in San Francisco, and they continue to do their outreach and try to help and outreach to these kids. But it's just a very, very hard time. And we know that for society in general, mental health and addiction is going to be a real challenge going through this and coming out of it, exacerbating pre-existing problems we have as a society. And for these young people, we know that mental health issues tend to first show up mostly between age 14 and 24. We have to make sure that we're supporting these kids now and as we transition out of the shelter in place.
These young people have the histories of surviving such trauma, and with that trauma comes resilience. So one could say they are survivors.
These kids are tough, and I interact with a lot of our at-risk LGBTQ youth, some who are homeless, some who aren't. They are really tough, but they're not like invincible, right? These kids have suffered trauma. They are vulnerable in many ways, and they need a lot of support. And sometimes the toughness is a veneer, right? They're big teddy bears underneath. They have to be tough to survive or appear tough, but they are vulnerable, and they have the same vulnerabilities and sensitivities that other people have.
In preparing for our discussion, reading some of the stories about what's going on in the community as it relates to COVID, some of the advocates and activists out there are noting a fatalist feeling in the community. You know what? I don't care. If I get it, I get it. Oh, well. And then that leads them to be less likely to seek care or less likely to take care of themselves. Now, that attitude isn't exclusive to the LGBTQ community, but that's tragic. Not surprising, but tragic.
Yeah, there was actually an excellent article in The Atlantic recently by a doctor at Harvard Medical School called Quarantine Fatigue is Real, talking about you can't just have strict quarantine unending. People rebel eventually, and people are people. We're not perfect. And she compared it to the early HIV/AIDS days. People, especially for gay men, saying can't have sex, right? That only lasts so long. People are not going to be celibate perpetually. And over time, our community learned what we call harm reduction, right? That you can't expect hermetically sealed, perfect existence, that people are going to be people. You have to meet people where they are and make sure that people understand risk levels. This is low risk, medium risk, high risk, and that people can protect themselves and make informed choices and risk choices. And the same is going to be true as we come out of shelter in place in COVID until we have a vaccine. Understanding that being in the backyard with 6 people who are separated is going to be fairly low risk. Having a dinner party inside where you're all sitting next to each other is higher risk. And just making sure people have that information and not judging or shaming people for not sealing themselves off from the world, but having that harm reduction model. And I think the LGBTQ community understands harm reduction well. And I know as a gay man, I'm probably more comfortable with risk, smart risk, calculated risk, than people who have never experienced severe diseases, as I have not personally, but in my community. We learn that, and I think harm reduction is a really important concept as we move through the post-strict shelter-in-place, pre-vaccine world.
Let's talk about AIDS. We've mentioned this a couple of times. Flashback to the early 80s when this strange and shocking new syndrome emerged that transformed and devastated millions of lives of LGBTQ persons around the world. AIDS exploded within the gay community. The government, the federal government in particular, showing apathy and ignorance, just ignored it. We were young men at the time of this. I was in college. You were younger, I believe. Give me your perspective on where we were with AIDS and where we are with COVID.
Yeah, I came of age as a gay man in 1987 when I was 17 years old, and that's a polite way of saying that I, acknowledged that I was a gay man and started to have relations with other men. In 1987, 17 years old, when there was no effective treatment, when sex for gay men was just psychologically linked to sickness and death, and the federal government was just doing almost nothing, and it was just a very scary time, especially for a teenager who was coming out. And it was one of those times where you wonder what is going to happen. And you're right, it was the people who were being impacted and perceived to be impacted were gay men, trans people, and people who were injecting drugs. And we were all considered disposable. And that started to change when, the first real step was when, I think when Rock Hudson died, that, elevated it for a lot of people.
I remember that.
But then particularly when Ryan White, that boy.
The young boy, yes.
Young boy in the Midwest who, through a blood transfusion, became positive and died. He was viewed as, it wasn't his own behavior that caused it. He was a victim, right? There's that distinction. You're not a victim because you chose to have sex or to use drugs. You're a victim. But he was obviously, it was a terrible tragedy that this child died. Horrible tragedy. But fortunately, his family used it as a way of educating the country that this can affect anyone. And so the Ryan White Care Act was passed in Congress to start federal funding. And so it took a child dying for the federal government to finally do something about it, which was, it's good that they finally did, but had Congress and the president acted 10 years before, this would have been a very different pandemic, and many, many lives would have been saved. And you compare it to COVID, where it affects everyone disproportionately, but even if you're wealthy and white, you can still die. And we're seeing such a broader impact that we see a different, obviously, our president, the federal government bungled the response, China bungled the response, but they bungled, but then quickly rebounded, and massive investment in treatment and vaccines and ramping up of testing and contact tracing. So we're seeing a different response, and that's a good thing. I just wish that it didn't take everyone being impacted to see the importance of quick government response.
And 40 years later, there is still discrimination against the LGBTQ community in the science and medical world. A tragic consequence of the AIDS epidemic is the rules that the FDA imposed, which are mostly still valid today, prohibiting sexually active gay men from donating blood or plasma. It was supposed to be a precautionary measure, but the ban has not kept up with the advent of technology based in bias rather than science. You sent a letter to the FDA challenging this protocol and this rule. What happened?
Honestly, it's at this point, it is just beyond shameful that the FDA is making and maintaining rules that literally have no basis in science or rationality, that are based exclusively on discrimination and stereotypes. And the FDA, they don't even bother to try to explain this discrimination. And so, in the 80s when this started, and we didn't know that much about HIV, the FDA just said, if you are a man who has had sex with another man since 1977, you are categorically and permanently excluded. The problem was, as we learned more about this virus over time, they just kept the rule in place. And until 2015, until even in 2015, with all the testing technology and everything else, if you were a man who had sex with a man since 1977, even if you did it once in 1977 and never again, you were permanently banned. So then they went through a process saying, let's reevaluate it. It took like a year or two to do it, and they put out a revision. We were also excited they were finally going to change this. And their revision was, if you have had sex with another man within the last year, you're banned. So if you're a gay or bi man, you have to be celibate for a year, or a woman who has had sex with a man who's had sex with a man. And that makes no sense because the testing is so good now that there's a window period of only 10 days. So if you draw blood today and test it and it's negative, that means that as of 10 days ago, you were negative. And so if they were to say you can't have sex in the last 10 days, that would at least have some basis in science, but they did a year. So when COVID broke out and there was immediately a fear and a growing shortage of blood because people couldn't, go out to give, and it was just the system was in jeopardy, I sent a letter to the FDA saying, can you please change this rule so we can all give? Others did the same. Even U.S. senators, Eleni Kounalakis led an effort among lieutenant governors. And they very quickly changed it from, okay, instead of a 1-year celibacy period, it'll be a 3-month celibacy period. So, of course, that's less bad, but it's still effectively a ban. Say you have to be celibate for 3 months in order to give blood. Still, they gave no rationale for why a year versus 3 months when the testing is 10 days. And why aren't you applying this to straight people who are sexually active? Because you can be a straight person and have sex with 5 people in the last 2 weeks and then turn around the next day and give, and you're not screened out.
Exactly.
But if you're a gay man who had sex the same way or a month ago, you're screened out. And so we're continuing to push back because it also applies not just to blood but plasma.
Right.
And we think that it seems like plasma from someone who's recovered from COVID could be used as a treatment for severely ill people, but gay and bi men can't donate. So we've tried to elevate the issue, and I think as it was a group effort, I think we did. I also organized 2 blood drives with the Red Cross that we called Give for a Gay blood drive. So you can recruit someone to give for you, or you can give on behalf of a friend who is banned, again, to try to elevate the issue. And several hundred people gave in those blood drives, so it was good.
Mayor Breed gave on your behalf
Yes.
at one of the blood drives. There's this picture, I know you've probably seen it. You are standing there in this photograph watching Mayor Breed give blood on your behalf. When I first saw this picture, and the couple of times I've looked at it since, it's moved me in some particular ways. It shows you, a gay man, an elected official here in California, a longtime resident representative of San Francisco, standing at the foot of this reclining chair as Mayor Breed donates blood on your behalf because you can't donate blood. You still, as a gay man, face this visible, tangible barrier to full participation in the public health and safety process. And ironically, or also, there is a black mayor of San Francisco, a black woman who herself and her community not too long ago probably would have faced those barriers. There's a lot of dynamics here. But when you see that photo, does that resonate with you like it does with me?
It does. I mean, and it really, and Mayor Breed, she's been a friend for a long time. We were colleagues on the Board of Supervisors. She's done a fantastic job as mayor, and she's just a good, decent human being, just a genuinely good person. And so when we decided to do this, and I called her up and I said, hey, would you give for me? She immediately said yes. And to me, it was a show of solidarity, right? And she's a very busy person. She took time out of her day to give blood and to do it specifically on my behalf. And I'm just very deeply appreciative of that. And we all, of course, acknowledge that it shouldn't have to be that way. And we're not trying to defend the system. Frankly, we're trying to call attention that the mayor has to come and step in to give blood for the senator because the senator happens to be a gay man.
Exactly.
And is irrationally banned from giving. And so, it was moving. But that day, there were also plenty of other people who were there. And actually, a couple of days later, I was walking down the street, and this guy walks by me, and he says, hey, I just gave for my friend at your blood drive the other day. So I think it was moving for a lot of people who, friends could step up for friends.
I think it also speaks to the diversity and the beauty of the city of San Francisco. The fact that a black mayor and a gay white senator can have this coalescence, can have this partnership.
Yeah, I mean, San Francisco, it's a beautiful, amazing place for a lot of different reasons. And one of those reasons is that we embrace diversity as a strength. We're not scared of diversity like, some people in this country are trying to peddle. That, having a mayor who is, a black woman, and having a board of supervisors that is very diverse, having a state legislative delegation that's diverse. We value including all voices, and it's a beautiful thing about San Francisco.
This pandemic preoccupies our time and focus in terms of life and public safety and policy, but California has had its own share of pre-existing conditions, if you will, before the COVID virus came upon us, including the crisis of the shortage of housing in our state. And the legislature has for a long time pushed with urgency to create more dense city housing near transit stops and job centers. In recent years, you, Senator Wiener, have been the one leading that legislative fight. So now with the coronavirus, there are many skeptics that are distrustful of housing plans and further considering housing density, as we talk about, as a solution to this crisis, because density is the opposite of social distancing, and in our new world, Density, when it comes to housing, could be a death sentence, some people say. You, as the author of one of the key pieces of housing legislation in recent years, have argued that our fear of urban density could warp our public policy and really harm cities. You've opined about it in an article in the Atlantic magazine yourself that you've published. Explain what the dynamic is.
Yeah, this whole idea that housing density fuels COVID-19 is completely bogus. It is baseless. It is false. And yet, unfortunately, it started because one city, city of New York, which had a slow and flat-footed response to COVID and paid the price, because you have that city that had a bad and delayed government response, is a dense city. So you have the governor of New York, who frankly was covering his rear end, if I may be blunt, and instead of taking ownership for his own delays, and there's been a lot of reporting about how badly the state of New York responded early on because of the governor and the mayor. Instead of taking responsibility, said, oh, this is just because New York City has density. It's all about density. And that started to fuel a narrative which the NIMBYs then latched onto. And it's false, because if you look at, yes, New York had a terrible time with COVID, but you look at the 5 boroughs, the densest borough, Manhattan, had the lowest infection rate. The least dense borough, Staten Island, had the highest infection rate. The second densest city in the United States of America, San Francisco.
And internationally,
Yeah,
there's Tokyo, there is Seoul, South Korea.
Taipei, Singapore, Hong Kong, Asian cities that have certainly struggled with COVID. Everyone has struggled, but they have been able to always quickly contain it because they had good government response.
And they're the poster child.
And they have huge public transportation systems. It's not about density of housing. I live in a 39-unit condo complex, and I have my own unit, and I don't have any problems sheltering in place from my neighbors because I have my own unit. Where it's not about density of housing, it's about overcrowding of housing. You know, if you think about it, if you have 10 families living in each to a unit in a 10-unit apartment building, that's dense in most places, versus numerous families living all together in the same housing unit because there's not enough housing, who has more risk? It's the people who are crowded together when you have 3-4 families living together. And so it's not density of housing, it's overcrowding of people. And how do you get overcrowding of people? When you don't have enough housing and it becomes too expensive. And so Manhattan has less crowding in individual units than a Staten Island or a Queens or a Bronx that got harder hit. And so when we don't do housing density, 2 things happen. We get overcrowded housing, which is a problem for health, and we get sprawl, which is a problem for climate change. And there have been studies, too, of China, of Chicago, that you have lower density areas that have the same or sometimes even higher risk than the high density areas. So we need to just let go this bad argument and focus on the real factors, which are, is there a good public health government response? And are we forcing people to live in overcrowded conditions in individual housing units?
This argument is going to continue on the density versus non-density as this legislation and this policy continues to move through the process. Are you well armed? Are you prepared to continue this debate?
We are, and I think we're working on some good housing legislation this year and working with the pro tem and others, and I think that most people understand that it's a bogus argument.
Final question. San Francisco, as we said, has been praised for everything that it's done up to this point, sheltering in place, protecting its citizens. It's starting to roll out now, not just for San Francisco, but for the rest of California, the rest of the country. Sheltering in place was the easy part. We now have this experiment of trying to go back to something resembling what we had before, although the likelihood of that coming is not for a while, at the very least. How are we going to do this? We have been capable of so much already in the last couple of months in our innovation and our redesign and retooling of everything. Can you imagine what we're capable of with the rest of the things we deal with in the state moving forward? There's a whole polyglot of things here. Give me your perspective on life here in California as we move forward and out of this.
It's going to be gradual, and it is a temporary new normal. It's not permanent. We will eventually have treatment, vaccine, or eventually get herd immunity. I hope it's the former, not the latter. And we'll get out of this, and we'll get back to normalcy. Hopefully we'll learn some lessons and not go back to bad normal, but the good normal we'll go back to with human interactions. But until then, it will be different, and we're going to have some degree of social distancing. We're going to have masks, lots of hand washing, all the different things that we need to do to reduce risk. And we know what needs to happen, and we just need to do it. And it'll be weird for a while, maybe unpleasant. I don't like wearing a mask. I don't like not being able to be sitting right next to somebody, but we're going to have to do it for a while. And we just have to psychologically train ourselves to be like, we just got to get through this, and then it'll be over.
And on that note, we will end here. Senator, thank you so much for your clarity and your conversation, being so candid. I wish you a joyous and safe and reflective Pride 2020, and I hope we'll have you back again here on Then There's California.
Thank you, and happy Pride.
Thank you. And that is a wrap for this edition of Then There's California. We're a production of the California State Senate Democratic Caucus, with technical assistance and great ideas from Martin Ashley, Bob Brulte, Brian Shadden, Rainier Sabiniano, Gunjan Patel, John Roman, McLeana Woods, Lisa Murphy, Faith Colburn, and the graphic design talents of Tim Davis. On behalf of State Senator Scott Wiener of San Francisco, the chair of the legislature's LGBTQ caucus, I'm Brian Green at the state capitol in Sacramento. Stay safe, everyone. Thanks for listening to Then There's California.